Welcome to a joint hearing between House Healthcare and House Agriculture, Food Resiliency, and Forestry. It's the first time we've ever had a joint committee in my time here, so this is pretty exciting. Today, we wanted to gather together to get the state, the landscape right now of H5N1 or avian flu. And thought it would be beneficial for both committees to hear that. We have Dr. Mark Levine with us. Just acknowledgement to Chair Durkee as well.
Yeah, thank you for bringing your committee together with ours. I'll just say that we had some testimony in the House Agriculture Committee about a month ago from the State Veterinarian's Office and the Agency of Agriculture, and heard what was happening with respect to the dairy industry, with our poultry industry, with backyard chicken flocks. There were also questions that came up then about farm workers. And the folks who were in then, I think rightly said that's a question to direct to the health department. So here we are a few weeks later. Yeah, thank you.
Okay, welcome. And if there are questions, would you prefer till we wait until the end, or would you?
I think we have enough time that you could intersperse with questions if you need to.
Okay. And I was going to say, let's use our hands.
Okay.
Yeah, the slides for this is on House Agriculture's website, not on Healthcare's. Those of us who would like to follow along.
Sitting here trying.
Thank you. Thanks for being with us. Go ahead.
So, Mark Levine, Commissioner of Health. Happy to be with you here today. Based on the comments I just heard, I'll ad-lib a little for a second. The definition of zoonosis is an infection that's normally seen in the animal world, but jumps to the human world. So this description you just provided us about what happened in committee is actually far-sighted because this is our reality from this point on. You may or may not regard COVID, the coronavirus, as a zoonosis, but many believe it is. If avian flu became part of the human experience, that would sort of be a zoonosis. But there are many, many emerging infections, we call them, that we have our eyes on because that is sort of what our future is going to look like. Some of it related to climate change, some of it related to globalization, the way humans interact with their environment, the proximity of humans and animals, different than it may have been in past times. Lots of explanations, but this is really the way things may go for the future. So this is a good topic to sort of jump off with, if you will. I will be saving my the scary part for the end. And I put that in quotes, but that's at the end. So let's just do an overview of influenza A, H5N1. Keep in mind what's going on in the communities right now, and we're closing schools and what have you, in addition to norovirus, which causes gastrointestinal symptoms, is influenza A, but the human varieties of influenza A. So, guess we have to move something out of the way. No, that's going to stay up there, I guess. Okay, so this term began as highly pathogenic avian influenza, HPAI. Now it's being just much more commonly referred to as H5N1, which is actually the strain that's circulating. But this virus has been around actually for some time. and it is extremely pathogenic in birds. You may have found birds even on hikes. There's a lot of migratory bird activity, especially with waterfowl throughout the region, all the flyways in North America, and these birds are being significantly affected. Now, as a sort of amateur ornithologist, bird watcher of my own, it's really kind of devastating in some ways because birds are actually suffering in terms of numbers of species and how prevalent they used to be versus are now. And these kinds of infections that can really decimate a flock can be very severe. However, this was always much more just in the wild birds and never really impacted others or humans. H5N1 now is a little more impacting animal health in general. Again, very minimal impact on humans, though I'll illustrate to you what there is going on. In the last 25 years, there have been 900 cases worldwide, different strains of this virus in humans, but if you think about the population of the Earth, this is an infinitesimally small number. Now, to give you some perspective, if we look at birds alone in the left-hand column here, we see that for the last couple of years, this agent H5N1 has been significant in causing mortality. In Vermont, we've had 100 wild birds, which means that's, of course, a lowball estimate because there's plenty of wild birds we're not going to find that have died from this, and 5 backyard flocks, 2 of which have been in the last month. One in Swanton area, one in, I believe, Windsor area. And when that happens in a backyard flock, everybody kind of knows what's happening because suddenly some of the birds aren't behaving well or they're actually dead. And those flocks get culled very quickly and the problem usually ends at that site. The middle column is mammals, which is the new wrinkle for this virus. Whether you're talking about the dairy population or cats or ferrets or, as in the picture, sea lions, whole bunches of species have been gotten ill from this virus. In Vermont, we've documented a bobcat in January a year ago. And then the dairy cattle situation is very new and was quite unexpected and not predicted by anybody. And it's very different than things on the left because most of the cows aren't dying from this, but it significantly impacts their milk production. And some of them get sick in other ways, but not so sick that they are dying in front of you like the chickens are. And this is a nationwide phenomenon where we're close to 1,000 herds in general have been implicated, most of them in 16 states, all sort of west of the Mississippi. 700 plus have been California alone. And that's a significant impact. But northeastern states have never detected this. And there's some reasons why it has not spread recently, which we'll get into as we go along. If we look at human experience in the US, there's less than 70 cases. And the reality is they're almost all what we would call mild cases. The majority, but not all, in dairy workers. The majority of those, conjunctivitis, which many of you know as pink eye, probably related to touching something and touching your eye, or to milk splashing into your eye if you're a farm worker. But there have been a few more serious illnesses that we'll get into. And then the poultry who die are a significant potential source of infection to humans, but we don't have a lot of confirmed cases from that pathway. which is why the CDC continues to list avian influenza as a low-risk proposition for humans and the general public. Though if you're a human who happens to work on a farm or works in a poultry capacity, your risk is higher than low, but it's still not necessarily super high. And if you are exposed, like you might be with a barnyard flock or on a farm, we have a whole protocol for monitoring for symptoms, making sure that we know what happens to you and others know what happens to you over that period of time. It's usually about 10 days. There's a nice little picture here on the right showing that basically wild birds can lead to infections in poultry, potentially, but not often, cows and cats. And then the cows can obviously cause infection in those same other species and humans. There have been cats discovered on farms that never left the house, so they never had contact with the cows, but they became sick and died of H5N1. So that's probably related to things being trapped into the house, boots and what have you, or what we call fomites in inanimate objects that can transmit disease, which is a way flu spreads in humans. Touching surfaces and all that, touching doorknobs could potentially spread regular flu in humans. You may recall from COVID, we once thought that was a major way for COVID, but it turned out all the disinfecting wasn't really the deal breaker, it was really the respiratory route, much more prominent. So the good news is, forever we've been able to detect influenza A virus. Most labs that figure out if a human has influenza A won't be figuring out if they have avian influenza, but they'll figure out what type of human influenza they have. Our health department can detect the avian influenza, which has led to some protocols that I'll go into as we move along here. The other good news is there are drugs that are still on the market. They're not like the most super effective drugs against the flu, but they do have an impact on the flu. And so we believe these are effective and could be a treatment if humans became a big player in this. And then there's actually candidate vaccines that are under development because everybody's alert to this. There's also a small stockpile of a previously designed avian influenza vaccine that hasn't been used or anything, but it's available. Nothing on the scale of what one would need if this turned into a true pandemic. So it's obviously common sense to think about how you can protect yourself if you work on a farm or work with poultry. And it's really not the rocket science things, it's things that would all make sense now that we've all been through a pandemic ourselves. We know about washing our hands. Well, you certainly want to wash your hands if you're involved with animals or animal products. I mentioned the cat dying in the home who've never been out of the home. You want to make sure that you don't bring things into your home that are from the farm, like on your boots. Protecting eyes, because conjunctivitis has been found in humans. Protecting your mouth from droplets. And of course, involving vets if animals don't look well. And now the additional layer is all dairy farms are alert to H5N1 and fearing it, so they may actually have PPE already, which they could have requested through us, and we made that known to them, or they can obtain PPE quickly to start doing some preventive work if they're concerned about their herd. And that goes through every item listed on the slide. So let's talk about some of the joint work that we're doing as departments, ag and health. And just to put in a good word, this isn't the only thing we do together. We have a good history of collaboration, which goes through milk products to maple syrup products to the triple E virus this summer and the mosquitoes. And now we have this wonderful new opportunity to collaborate. So what's happening in preparation? Well, we all have protocols for what we would do and how we communicate. We have a joint letter to the dairy industry offering PPE, as I just mentioned a moment ago. And there was some uptake with that. I'm not saying everybody just sort of, tried to get all the PPE they could get, but there was uptake from that. And now there's awareness, which is even more important. You may have heard or read in the news recently about the testing program on bulk raw milk. So basically, every farm in Vermont will have been tested once a month going into the future. And that testing is sort of pooled together and then sent, I believe, to Cornell and other places like Iowa where testing is done. If it's a positive, then it sort of comes backwards and you have to figure out which contributing milk was the positive or which ones were the positives. We have not had any to date. One of the reasons it's not spreading to herds in many states that never had it is because of the testing requirements now. So nobody in Vermont's going to buy a cow from Texas and not know that that cow is free of H5N1. Plus, they don't usually buy cows from Texas. It's not just the way it works here. So they're very careful in this interstate commerce part of things. We have a laboratory that does a lot of testing for the state. So now, if there's a person in the state sick enough to be in the hospital with the flu, human flu, of which there are apparently plenty right now, even some of our small hospitals have 3 or 4 people in their hospital with the flu. This is like sort of peak of flu season we're seeing right now. We will have them send us their specimen, and we will then do additional testing to speciate the variety of flu they have to make sure that they only have human flu and don't have any avian flu floating around in their system. And so that's going to be sort of an early surveillance mechanism we can use. We have done testing already in the last few weeks, and so far, so good, nothing. And then if it came to the point where one of the farms did have a positive on the bulk milk testing, or they had sick cows and we found out they had this disease, we in the health department have a whole contact tracing. Use some familiar words that we use in any infectious disease to try to make sure we know who's been exposed, who needs PPE, who needs to be tested, the whole works, and give people sort of good monitoring parameters and symptoms to follow, etc. Last summer, seems like not that long ago, but it was in July, we came together as 2 agencies and had a tabletop exercise for emergency planning purposes. So we had the state agencies, we had farmers, we had community partners, we had hospitals and healthcare partners, and basically the problem was a hypothetical outbreak on a farm in Franklin County. And we had people around tables and all getting into great discussions and figuring out what they actually had now as resources, what resources they didn't have at all and would need to have, and how to work well together with each other so we minimize the impact of any such kind of incidents. Bridges to Health is a major community partner, especially with our migrant farm worker population. And we sought a lot of guidance from them as well. They happen to be trusted messengers, which is always key. Just like in the pandemic, we had many new American communities that really needed trusted messengers to get testing, get vaccination, uptake, everything like that. Bridges to Health serves, and others serve as trusted messengers in these communities. We have local health officers who have relationships already with all of the partners in their region that they need to. And we have our own partnership with Ag and Health together. And I can dare say that Anson Tebbets and I are, this is sort of going back to Jerry Seinfeld, on speed dial with each other. So we know exactly when to talk to each other about anything, even if it's not a case, just about a new development from either health or DEA or what have you. DEA, no. What's the agricultural one?
FDA.
No, that's the national one.
Oh, USDA.
USDA, thank you. All these acronyms. So, anyways, so we learned from that tabletop exercise about the lack of familiarity with public health workers and public health processes in the farm worker community, and had to find ways that we could educate and become a trusted partner when it came down to testing and treatment. We didn't have a lot of public health messaging to that community, and what we did have doesn't always recognize the unique needs, especially interpretive needs and terminology needs, etc. We learned that the community partner population also has its own set of needs with these populations. And we learned that, surprise, surprise, some organizations struggle with stable funding to support what they do. So we took some action steps, which are listed here, using an app to reach farm workers, making sure that we have all the resources translated appropriately and can turn them around quickly, making sure that we have all the resources for even people who can read English, just to make sure that the language is appropriate and the concepts are getting conveyed across, and tested those out. Working with Bridges to Health on stigmatization, which is a significant issue, and now, of course, with immigration being such a significant national issue, we have a little more to be afraid of in terms of people stepping forward because they're fearful for non-disease reasons. And most importantly, we vaccinated a lot of farm workers, and most of that was the flu. Some of it was COVID, some of it was tetanus. But that was a really good success to have 51 vaccine clinics this past fall. So here's where I get into the interesting human stuff. Hope I've reassured you that we feel very comfortable with our sort of collaborations with the farm communities and the farm workers and agriculture and health, and if things start happening in that area, I think we know the pathways forward. It's a little scarier if they happen because of the actual birds themselves. So I mentioned, we had under 70 cases in the country. The majority were farm worker associated. There's a case in Canada, in one of the western provinces, that actually was a younger person, thought to have avian genesis, but not completely clear, and ended up on a respirator, blah, 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 but ended up recovering. And we have one case here in Louisiana that was a more chronically ill person who did have bird contact and eventually expired from the case. But that's the US experience. It's not huge. There's more recently been something reported in Nevada, which I never thought of as a dairy state, but there was cow infections there, and I believe a human infection was documented. I'm not sure if it was serious or not. So what do we fear? So I said the risk to humans is low if you're not working in these animal-related capacities. The CDC lists the pandemic potential as medium, but they don't really define what that means. But I'll sort of tell you the scenario that we all are thinking about. So we're in the peak of flu season. Flu is like passed around from person to person. We have a frankly lousy vaccination rate, so it's going to be passed around even more frequently. And that sets the stage for the nightmare scenario. So the nightmare scenario is all these humans infected, somehow the bird flu gets into one of these humans through exposures to birds, animals, cats, who knows what. And that human becomes, if you will, a petri dish. It has concurrently got the human virus making it sick, and now this new avian virus, which up until now hasn't made anybody super sick, pretty much. That allows what we call genetic reassortment to occur. So viruses multiply all the time, they mutate all the time. So in that one person, could those two viruses exchange some genetic material, increasing the virulence of the avian virus, and maybe giving it the ability to infect human respiratory epithelial cells. Right now, it doesn't seem to like respiratory epithelial cells. But the way you get human-to-human transmission is people coughing and breathing on each other, and the virus attaching to the respiratory epithelium and then getting into the body that way. So potentially, that is a way that the avian virus could then mutate and become capable of being a human infecting virus passed from human to human. It's even more likely to occur in like the Louisiana situation if you have a host who actually is a bit immunocompromised, so their normal ability to fight the virus isn't very good, and it tends to mutate a little more freely. And we've seen that just with COVID's experience, which is why we're always so hyper about older people and immunocompromised or chronically ill people getting vaccinated, so that doesn't happen yet. So that's sort of, you can call it science fiction or science, but it is something that is potential, but we have not seen at this point. What we have seen, and the Louisiana patient illustrated this, is the virus that entered that person's body was different in terms of its genotype than the virus it had at the time of death. There had been some mutations occurred that is not unexpected, but again, could be the way that this scenario I've been describing pans out. So how do you prevent this from happening? Well, I mentioned the early warning systems and surveillance. That doesn't necessarily prevent the genetic reassortment from occurring, but it gets us aware and alert on an earlier stage so that maybe we're not going to have so much spread of something really pathogenic to the population. But the other way, of course, is for people not to get the regular flu. And I would say we are not succeeding in that effort because in 2024, our vaccination rate for flu vaccine statewide, all ages, all comers, was 40%. And this year, at this point in time, we're about 34%. Means we still have a few more months to go through, but I'm not sure we'll reach 40%. Now, of course, in our older population, we're double that, which is fine, but still, there's a whole population up there that really isn't that protected from the flu. And that's just a problem, because that's our biggest defense against this scenario kind of occurring. But again, the good news is we have the tests right now. We're using the tests right now. We can adapt the test if needed, if the genotype changes a bit. We do have antiviral drugs, which farm workers and their employers are all aware about. So people who might get ill can be immediately treated with a readily available anti-flu virus drug. And we do have those candidate vaccines that from the past in the stockpile, as well as being researched actively. So the AIH funding hasn't been turned off. They're able to continue to work on those as well. So I think I'll stop there, and there's references if you want, and I'm sure there's a ton of questions.
I think we have a comment or a question on Zoom, actually.
Sure.
Evie Flory?
Amy Flory is from our department, our AAFM, and I'm sure has something relevant, not to question, but to say.
Thank you, Dr. Levine. I just had one clarifying point on the bulk milk tank sampling that we're doing at the agency. When those samples are sent to Cornell, they are not pooled together. So they are sent individually marked from each farm. So when they are run as the individual sample representing each farm. So each sample is sent representing each individual bulk tank, so they are not pooled. The rest, most of the states across the country, those samples are pooled under USDA's program, but for Vermont, because of the amount of milk that we export, we are doing a higher level of sampling at each individual farm. So,
Appreciate your clarifying that, and again, Vermont leading the way, because this takes a big step out of the process. Should there be a positive, we know exactly where the positive was, and don't have to go further steps to research the super.
Yep. Absolutely, and it will allow us to respond quicker and work together as sister agencies. So,
thank you.
And
If that's the only thing I spoke on, I'm doing really well.
I've seen a few questions. I'm going to start with Representative Chena, who's joining us.
I'm wearing a mask because I keep getting sick. And after what you said about us being thank you, that's comforting, because I was wondering, I was craving worms, But seriously though, I have two questions. One has to do with mutation, and I heard you were talking about bird flu and human flu type A, possible, like the theory that, or the possibility of them mixing. I heard that that's happening right now with COVID and RSV, and I know it's a little off topic, but I didn't know if you could weigh in on that. And then the second question was, what is the impact of federal policy and funding changes to the CDC and NIH on the nation's ability to respond to a flu pandemic or a COVID pandemic? Resurgence.
You thought you'd start with the softball question, not the hardball. So the first one, every time we announce a new set of letters about which COVID virus is being found in the population, that means a mutation has occurred. So viruses mutate. They have a very rapid reproductive cycle. It's not like humans where, 9 months later there's a baby. The virus is like this. So they mutate all the time. Fortunately, what we've seen in coronavirus is that none of the mutations are causing it to be a more serious illness in people. It's just a more transmissible illness. So if you're the more transmissible virus, you eventually take over, and the other ones fade away from the past. So that happens commonly, and that happens to flu viruses, and the way you know that is you never get the same vaccine year to year. Every year we're getting a different flu vaccine based on the experience usually of last year and the Southern Hemisphere in their winter, so that we have a good idea about what strains of flu are circulating. So that's pretty much common. And it would be surprising if we saw the avian influenza not mutate as well. Just we don't want it to mutate in the way I described in that nightmare scenario. Second question is, remember Ebola virus?
Yeah.
Well, it's still alive and well in Africa, and there's a major outbreak in Uganda right now. And very quickly, we had our CDC contacts talking to us on our state health official call, which we have every week with ourselves and other organizations. And CDC requested to come and talk with us because of what was going on there. Not that it was jumping to this country or anything, but the implications and just to give us a good situational awareness of what was happening. So my staff at the Department of Health can readily contact people they need. You know, we've had some Legionella in the state, and we've contacted CDC, and the people we're used to talking to, we can talk to when they haven't already left the federal government, and that's working fine. Do we have the ability to mount a response for another pandemic? That's a great question, and it's a harder one to answer. Right now, CDC still exists, and pretty much exists in the form it did exist, and the secretary for HHS hasn't been voted on at the whole Senate level yet. There's no CDC leader, there's only an interim leader. So, you know, right now things are in a place where that's okay. I don't know where those things are going in the future, because there's lots of talk about breaking up CDC or just taking some of its roles and casting them aside, but leaving usually the infectious prevention roles there, which would be important. We have an administration and a president who, when he was the former president, did have Operation Warp Speed and got vaccines going well. I would anticipate that happening again. But at the same time, we also have lots of, at the federal level, unfortunately, but everywhere, misinformation being transmitted. So I'm not confident that more misinformation won't happen, and we have to combat that as best we can. NIH is threatened with some of its funding cut to major universities doing research. How will that pan out when it comes to actually working on all the things that need to be worked on? There are so many hypotheticals now, but I can tell you that what's going on, like sort of right now, is pretty much business as usual. And though there's a lot of anxiety around, there's actually still a lot of good work being done. And so I can only hope that that will continue.
If it was disrupted, though, would we be able to handle a pandemic? Like if it was significantly reduced, if the federal government in general was significantly reduced in size and function, we could handle another pandemic.
Well, the flu pandemic playbook isn't that different than what we used in COVID. There are variations, but we could do that. So I'm confident in that. I'm less confident in just the portion of the population that really is susceptible to the misinformation, doesn't believe that much right was done in the last pandemic, may not have the tolerance for going at it again in the future pandemic. So I'm not even worried as much about government as I am much of the general population. Not the Vermont population, but the general population in many states in this country. And then if the leadership only further fuels the fire in those kinds of conversations, that won't be helpful. So we'll have to see.
Thank you.
I think Representative Cordes, just in case I wanted to flip back and forth between committees, I didn't want to.
I'll just jump in then, if that's all right.
Yes.
I had noticed over the weekend a media report that, just following up on Representative China's question, and I don't want to either fuel or be accused of spreading conspiracy theories, but a report that the CDC had posted and then removed from its website some data linking the spread of avian flu from cats, domestic cats, to humans. And I wondered if that was something you had...
No, I'm not aware of that.
That's fine, if you're not aware.
4:30 today, I'll be on a call with my colleagues across the country and CDC. I will listen and ask if I need to. That's interesting. There have been things removed from the CDC website, I can tell you that for sure. But most of them have to do with people and 3 initials as opposed to cats.
Representative Cordes.
Hi. 2 questions. You, I think, partially answered the first one, which is, and I'm going to ask them both at the same time. Do you believe, or is there evidence to show that the campaign of misinformation around COVID vaccinations is correlated with the lower rate of flu vaccinations in Vermont? And then the second question is about the new H5N1 D1.1 strain. Is that more virulent? Is there concern that it's more pathogenic?
Yeah, and that's a dairy strain, I
Okay.
believe is what you're quoting. So I don't think it's more virulent. I'm not sure if it's more transmissible or not.
Okay.
With regard to the human vaccines, when a state like Vermont has uptake down to where we are, and yet we're continuing to lead the country with rates that we don't want to brag about, that says something for everybody. So, I do think there's a bit of fatigue from all of this. I think that people know that their level of immunity, even without a vaccine, is in a different place than it was prior to the existence of the coronavirus. Flu vaccine uptake has never been wonderful. I hate to say, it's been more wonderful than what we're seeing, but it's never been wonderful, because a lot of people who are healthier and not in a higher risk group just sort of feel like there's lots of respiratory viruses out there every winter, and they're going to get 1 or 2 of them no matter what. And a lot of people don't get a really serious flu, except maybe once every few years or 5 or 10 years, what have you. So I think in their mind, they're not associating the high need for a vaccine against some of the respiratory viruses, even when we tell them about some of the outcomes that could happen if they don't get the vaccine.
Or spreading it to someone else who.
Yeah, and I think there we're okay. I think people who live with people who they're concerned about being compromised in some way are probably doing their job. But I don't know what else to tell you. There's some great research in vaccine. There's a continuum. There's people who want vaccine. There's people who are sort of vaccine skeptics, I'll call them, but they can be reasoned with and talked with and may eventually get the vaccine. There's people who are vaccine resistant, who are like, no matter what you say, it's like, vaccines are terrible and I don't need them. And then there's another group, which is larger than you think, of vaccine apathetic. So sort of like, it's just not on the radar. It's not something that you wake up every day and think about and worry about, and you go about your life, and that's that. And that group is influenceable as well, if that's a word, but still challenging because you don't always know who they are.
Thank you.
Representative McFarland, did you have a question?
Yeah.
Okay.
He always has a question.
I almost said Representative Topper.
At the present time, how is the cross-state movement of cattle in general monitored?
Oh, it's really, I think, monitored very well, and I might let EB help with that, but there's sort of a whole national and state-to-state protocol, and I just don't think it's possible to not know the status of a cow if you're purchasing it from another state. That's not Vermont's thing. We just don't do that, but I think it starts at the USDA level. EB, am I misstating anything?
You're doing great, Dr. Levine. I don't know. You might be able to double hit for both agencies. Not sure you want to though. No, there's federal laws, and then with USDA, APHIS, and then there's also Vermont state statute laws on animal movement. So both within our own state borders and then interstate requirements. And some of this gets into the animal ID laws that have come into place that our farmers have to have. And so there are things called animal health certificates that have to be issued by veterinarians for animals to cross state lines. And so there's actual permits that are required for animals to cross state lines. And those have to come into our office within our agency at Ag. And there's different reporting that occurs so that we are notified with animal shipments, and so that we can make sure as an agency and USDA as well, that animals that are being transported we're aware of and that they're meeting required standards. And if those aren't met, we do have regulatory authority to take action on them and require quarantines and other things. So that work is within our agency at Ag and our animal health section. And that's some of the day-to-day work that they do on a frequent basis of making sure that those laws and other things are being upheld. And we have been monitoring animal movements routinely from the impacted states. And thankfully for us in New England, for the states that have been impacted by HPAI, we do not routinely get animals from those areas of the country. And that's been, I think, one of the big reasons why so far we've been fortunate to not be impacted. And we do internally have processes that we've established to make sure if we had any animals coming from any of those states, we'll just call them internal red flags, where there would be additional questions and other things that we would have to review and additional quarantine requirements and whatnot we would be looking at to ensure that we wouldn't have potential issues coming into our state.
And that applies to chickens and turkeys and all that kind of stuff.
Yeah, but that's why as a public health official, I'm way more concerned about the birds, because it's the wild birds that are the ones that are incubating this virus all the time and letting it mutate and bringing it to Earth when they die, etc. And they brought it to several of these barnyard flocks because it's quite clear that potentially there was a pond that both sets of birds were using and interacting with one another. So,
Thanks.
I'm sorry, I Representative Nelson. Sorry.
Thank you.
I don't think we've had a chance to meet.
Maybe a question for you, Dr. Levine, or to Evie. The herd in Nevada, was that bird to cow this time? Did I hear that right? Reading up on it last week, or was it the same vector as before, Evie? Was it cow to cow?
I'm happy to take that one, Dr. Levine, if you don't want to. So, and I apologize for the record. I'm E.B. Flory with the Vermont Agency of Agriculture. The Nevada case, Representative Nelson, unfortunately, that one was wildlife bird to cow. And it impacted 6 different farms. And unfortunately, in that situation, the spread of that was not due to animal movements on those 6 farms. It was from wildlife birds in all 6 cases. So that was quite a blow of information that we received last week on that.
And is it the exact same strain, or is it mutated some? That's a concern that we have in the dairy industry here in the state.
So it is a different strain than the original one that came out of Texas. And the strain that they have in Nevada is the strain that has been going across the country that Dr. Levine's talking about in the wildlife birds. And it's the same strain that we had in Vermont with our 2 domestic poultry cases. It's what's been all across the country impacting commercial poultry houses throughout the country. And what is unique about this and discouraging is that yes, the strain was the same on the 6 dairy farms, but there were small, unique differences amongst it. So the strain is D1.1 is what it's being called, but there was enough differences between it that you could say that each farm did have their own somewhat unique strain. So the birds in this case, there was uniqueness amongst them that USDA could determine that there was no animal like sharing amongst the dairy farms. It was the birds giving it to each individual farm that was impacted. Some differences with those dairy farms compared to here. Those cattle, it's all open. They have no barns. There's no covering or anything like that. So the animals are just out in open air with the birds, including, their feed and their water and everything else. So that's definitely a big difference from there to here. And they're trying to mitigate some of those issues with using things like noise canyons and other things like that. Making recommendations to not have all their feed out where it's interacting with the birds, feeding their animals more often but less feed, and other things trying to mitigate their interactions that they're having with the birds. And the main birds that they are having issues with were starlings and blackbirds. And apparently that's like a frequent issue for them there. So there are differences in their layout than here in the Northeast, but it's very discouraging news to hear, to say the least.
Let's go with, since healthcare it turns out when you introduce healthcare to agriculture, we have lots of questions. I have Daisy, or Representative Rebecca, and then I'll do Representative O'Brien.
First of all, I want to thank you for your many years of service.
I was going to stand up.
And not to make light of a very scary situation, but I'm sure you want to go right now because I'm quite happy with your leadership through the last pandemic.
I've got till the end of March, it's all right. Hopefully flu season will be over by then.
Thank you. But I wanted to ask, given our experience, I'm thinking about communication to vulnerable or really at-risk populations, especially our migrant and multilingual communities who may not have access to emergency communications that in situations like COVID were kind of life or death moments as policy changes and guidelines happen so quickly. So I know you said that you are, through these, you were starting to use WhatsApp and you kind of changed the way you were communicating with some farms, but I'm wondering, now that budget season's here, can you remind me if VDH appropriated any money toward translation services or emergency communications toward farm workers, or translation or emergency communications of any sort?
We did not ask for new appropriations. I mean, we generally have that in our budget in terms of messaging issues, communications. But I'm not aware that we added.
Did we change after COVID, just through that experience?
Oh, yeah. Okay. Yeah, I mean, if you go to our website now and you want anything that's on our website in Swahili, it's there, and multiple other languages. Way more than there were pre-COVID.
I remember that. I'm from Winooski, so we're really grateful for all that you did through that. Thank you.
I'm supposed to do.
Oh, okay. Let's do Representative O'Brien. And what time were you at? 2:30?
Right now, yeah. With your sister committee.
Really quickly?
Sure. I just wonder if you could speak to transmission and immunity, because I was reading that, like you said, that wild waterfowl, it spreads amongst, but songbirds not so much. So what makes it, chickens so vulnerable and our chickadees not?
Yeah, that's a great question. I don't know the answer to that. And it may be that we don't have a good handle on some of the songbirds too. Just because they tend to be out in the woods all the time and they're not big like geese. I'm not 100% sure.
Thank you for joining us. We'll let you go. And thank you to Agriculture for inviting us.
Thank you. Yeah. Thank you very much.